Thank you, Dr. Kung, for the kind introduction and very warm welcome from our end. I will be presenting on photon counting CT technology, which is considered to be a quantum leap when it comes to the computed tomography imaging because of the potential this technology can deliver for patient care, reduction of radiation dose, and the new imaging techniques which are earlier not possible in computed tomography. Yeah.
CT will no longer be what you've known it to be. With a quantum leap, after which everything will be divided into before and after. CT will change forever.
So as you can see, this is about the world's first photon counting CT, which is a US FDA approved product, and the product name is NAEOTOM Alpha. So just to give you a perspective, all Siemens CT scanners, we have a family name called Somatum, whether it's a 16 slice, 32 slice, 256 slice, but the photon counting CT is fundamentally so different that we have to introduce a new family name by the name Neotom. So Neotom is the family name for a photon counting CT, and it's a great honor for us to present on this technology. But just to give you a perspective, so this product or the technology is released in FDA by FDA in 2021. So usually what happens when the technology is available, we as a vendor go out, introduce this technology, update our customers. But however, first time US FDA made a press release stating, announcing it to the radiology fraternity, announcing it to the world that they have approved the major advancements in computer tomography for a decade. Like there was no other bigger advancements when it comes to the technology for computer tomography. Likewise, it was considered as the top 10 health and medicine breakthroughs of 2021. Yeah, it is considered as a quantum leap, as you know, and this is the future of CT. And the photon counting CT technology, the moment it was released in the subsequent year in 2022, it got the best radiology device award from Ant Mini. It got the best IF design award. It got Red Dot design award because it has a latest generation technology called photon counting integrated with artificial intelligence to support and to help you in viewing the images which were earlier not possible. Yeah. Before I explain what is photon counting technology or how it is different from the conventional CT scanners available, whether it is from Siemens or any other vendor, I will just wanted to show you three examples of CT scanner which elevated the role of clinical CT. Yeah. So first example is in 1990 when a spiral CT was introduced. It enables contrast enhanced studies possible in a CT. Yeah, you can inject the contrast, can do angiography. That was the time when it was made available in CT. In 1998, when multi-slice CT was introduced, it enables cardiac imaging possible in a CT scanner. In 2005, Siemens again shook the world by introducing a technology called dual source, means two tubes, two detectors in one gantry, and revolutionized the CT imaging. Likewise, in 2021, photon counting starts a new era in computer tomography by introducing a technology which will redefine clinical imaging, whether it is for neuroimaging, whether it is for cardiac imaging, imaging. So I'll show you a few clinical examples also, how it translates or how this technology is different from any other CT scanner currently available, whether it is from Siemens or any other vendor XYZ. Yeah. But before that, let me just show you technically what is a photon counting CT and how it is different from current generation CT scanners. Yeah. So the schematic diagram that you see on the screen or the slide here is conventional energy integrating detector. So all CT scanners, whether it is Siemens or any other vendor, falls into the bucket of energy integrating. Yeah. So what happens in this detector technology? As you can see, this is X-ray photons. When it falls on this scintillating material, first these X-rays, which are invisible light, converted into visible light, and then there are photodiodes at the bottom of the detector, which takes this light and gives you like signal, the image that you see. Yeah. First thing is, in current generation CT scanner, it is a indirect conversion, like X-ray converted into light and light converted into electrical signal. So there's lot of important clinical relevant information which is missed out. And on the top of it, what you see, these detectors are built with keeping light in mind, because you are not converting direct x-rays to the signal or what you see as a radiologist or a interventionist on the screen. Yeah, it's an indirect conversion. And then we have these gray bars, the dead spaces that you can see within the detector, known as septas. These are introduced because the whole mechanics or mechanism behind having this detector is light. Yeah, so we have to avoid crosstalks and all that. However, these dead spaces introduce lot of inefficiencies in terms of you have to increase the radiation dose to the patient. So there are a lot of prestigious institute, I'm sure in Vietnam also soon will should see a photon counting here. So all the leading institutes across globe and also in ASEAN are also worried about the radiation dose reduction in radiation dose and getting information which is not possible. Yeah. And how photon counting CT is different, here you see on this screen, you see there is no dead spaces, there are no gray bars in the detector, there are no more septas required in this. So when the x-ray photons falls on this magical semiconductor material, so in the conventional energy integrating detector, it was a crystalline which converts x-ray to light and light to signal. Here x-rays are directly converted into signal. So each and every x-ray photon is contributing to a signal. That's how the name comes from, photon counting. In conventional energy integrating detector, the one image that you see is a combination of 30 thousands of x-rays together, whereas in photon counting you are getting signal or information from each and every individual photon. Yeah, see, 30,000 combination, one signal versus signal from each and every x-ray photon. Also, it's a direct conversion, single step, there is no intermediate step involved, there is no electronics involved which brings artifacts. Like in case of brain, you see sometimes posterior fossa artifacts and all those. There are no such problems or no such issues, or there is no requirement for reduction of all these things at all with the photon counting technology. And this together, this new radical detector technology known as photon counting CT. Yeah, so it gives you a very high contrast to noise ratio images. There is a potential to substantially reduce the amount of contrast media that you inject to the patients, because in patients suffering from diabetes or other renal insufficiency, you have to lower the amount of contrast media because of the renal insufficiencies. Also, it gives higher spatial resolution at same dose. Yeah, just to give you an example, all CT scanners currently available, the minimum slice thickness, let's say if you want to see a M2 or M3 vessel, is 0.6 mm with all other CT scanners. Yeah. First time in photon counting CT, we are acquiring at 0.2 mm slice thickness. So you can see finer visualization, which is not possible previously. Yeah. And then you have spectral information available, dual energy information for all the scans, because we are getting information from each and every photon. And I will show you a clinical image also. When I said that there is complete elimination of electronic noise, like we have reached to a radiation dose level which is earlier unthinkable in computer tomography. Yeah, in the past, in current generation CT scanners from other vendors or Siemens scanners, we used to compare who the radiation dose is just the same of X-ray modality. However, with photon counting CT, we have reached to a radiation dose level. We are no more comparing it with the any X-ray modality. So I'll show you an image also here. So NAEOTOM Alpha, which is the world's first photon counting CT, is based on quantum technology, and it's a dual source CT. Yeah, because dual source is still the technology step where you can do ultra fast scanning of the patients, where the breath hold requirement, let's say if you are doing a thoracic scan or any other scan, is minimum with dual source technology. Just to give you a perspective, NAEOTOM Alpha is installed in lot of premium sites across world, and I'm pretty sure soon it will be there in Vietnam also. So we have around 70 installations across globe, mostly in United States, Europe. Those were the early adapters of this technology. There are already 170 paper published on this technology. You can think of this way: so every fifth day there is a paper being published by the user of this technology. Also there are 300,000 patients being scanned on this technology. Yeah, just to give you an idea on the clinical advantages, I talked about the technical specs. Yeah, you have the reduction of radiation dose potential, smaller detector pixels. So I'll just give you a clinical advantage of having smaller detector pixel in photon counting technology. Yeah, here on the screen on the top is the image of stapes. Stapes is the smallest bone in the human body. Yeah. Here you see here on the left side, this is the image which is acquired on a conventional CT scanner with 0.4 mm slice thickness. On the right top, you see a image which is acquired on NAEOTOM Alpha, a photon counting CT with 0.2 mm slice thickness. So we have ultra high resolution imaging, high spatial images possible with same radiation dose to the patient. In the bottom, you see the cochlea. In the middle, this is the cochlea image which is acquired. I'll put a pointer also here just to show which is the image. So this is the image of cochlea and this is the image of stapes using high-end conventional energy integrating detector. And on the right, you see the images which are acquired on a photon counting for stapes and cochlea. So it has unmatched image quality, ultra high resolution imaging possible on a photon counting CT. Yeah. This is one example. The other thing that I talked about is there is no electronics, there are no ADCs, there are no photodiodes. So we have reduced the electronic noise. Yeah. And how it translates to reduction of radiation dose. Yeah. What is the impact of removing the electronic noise? And you see the impact in the radiation dose. Here on this slide, you see a scan which is done for ultra low dose sinus CT. Yeah. And the thing that I wanted to highlight here, the effective radiation dose of this scan is 0.0063 millisievert. In the past, or in any other vendor CT scanners, or when we also used to present from Siemens for our Somotum series, we used to say now in CT we have reached to a radiation dose which is just 2 times of X-ray or 1 time of X-ray. However, with photon counting technology, we are no more comparing the radiation dose with the X-ray modality. We are comparing with half day of background radiation. So if you get a CT scan which is a low dose CT scan on a photon counting CT, it is as good as we go out of this hotel and then expose ourselves just half day, or we take a flight of 2 or 3 hours from Da Nang to maybe Singapore. Yeah, it's that ultra low radiation dose technology or a potential is there. And so these are the live images from Czech Republic, who is the early adapter of this technology. So the leading institutions across globe, and as I mentioned, soon in Vietnam also have this installation, will change how the CT images are acquired or perceived, or uh, the potential of radiation dose and the clinical advantages. Yeah. So when you compare with the best modality or the best CT scanner currently available, it has been proved that the technology has a potential of further reducing 50% dose. Yeah, because one of the reasons we see, yeah, the role of CT is expanding for screening purpose also. We want to do head screening, lung cancer screening, whole body screening also. So we want to go as low as reasonably possible in a computer tomography. At the same time, you want to see images which are good in image quality, and perceive better when it comes to the your clinical outcome, or in terms of diagnostic accuracy. Yeah. Now I'll show you few clinical ologies. I'll be covering on cardiovascular or neurology and pulmonology, how this technology is benefiting when it comes to the your daily clinical routine. Yeah, so I'll be covering shortly on the cardiovascular also, how this technology brings more value when it comes to cardiac imaging or neuroimaging or pulmonology. But just to before that, I'll give you an example. Currently, for a cardiac CT, when the patient goes for a cardiac CT, there are 16% of the patients currently who cannot be scanned in any of the current generation CT scanners, whether it is Siemens, whether it is from any other vendor. And the simple reason is excessive calcification. There is the calcium score which is above 1000. As per the guidelines, you cannot scan that patient on a CT scanner for a cardiac. Yeah, what has been found out that out of these 16% of the patients which sent for intervention labs, yeah, 50% of the patients results in no stenosis at all. So it means if you had a CT or a imaging facility available who can scan those patients, these patients could have been avoided unnecessary being uh, in intervention labs. Yeah, first time photon counting CT exclusively made possible to see only calcium image and only iodine image. So first time you can remove the calcium and can see the pure lumen. You can see beyond the curtain of calcium. In all CT scanners, I'll say, I'll include Siemens also. If you have excessive calcification, patient has excessive, because you know that if there is excessive calcification distort the pure lumen, hide the underlying pathology. You cannot diagnose, you cannot treat properly. So we can see pure lumen also virtually removing the calcium, first time made available in a photon counting CT. Another example, nowhere in the world is possible to acquire cardiac CT with ultra high resolution with 0.2 mm. The current standard is zero point 0.6. Minimum, by increasing radiation dose, we could think of going 0.4 mm. In photon counting CT, we acquire at 0.2 mm, made available ultra high resolution cardiac imaging possible. Ultra high resolution has two advantages. It improves sharpness. Also, in terms of calcification, it reduces the blooming artifacts. Yeah. This is a very interesting case from Hungary, Budapest. So this is a patient with a calcium score of 1758. As I said, if a patient has more than 1000 calcium score, you cannot scan that patient a cardiac CT or on a CT scanner because of excessive calcification. However, this patient being scanned and diagnosed has been made on photon counting CT, which is exclusively made possible. Yeah. As I said, in neurology also, this technology has a great benefit. Like there are a lot of ologies, but due to time constraint, I'll be just covering on cardiology, neurology, and how this technology is a quantum leap when it comes to pulmonology. As per the current data available from 1097 CT systems across globe, for neuroimaging, 0.9% of the scans are with ultra high resolution mode. The simple reason is if you use UHR mode, you know that you are radiating a lot to the patient, which you don't want. Yeah. So only 9.9% scans are with UHR mode. Rest 99.1% scans that you do or acquire for neuroimaging is non UHR because of the radiation dose penalty in current generation energy integrating detectors. Yeah. But this is not the case anymore with the photon counting CT, where we acquire high resolution images at low radiation dose, ultra high resolution imaging with 0.2 mm at same radiation dose. Yeah. So these are the images from Netherlands which are acquired with 0.2 mm. You have better white matter. So there are a lot of publications now available in just last 1 year of span of time when the product is available as a US FDA, saying that yeah, the gray white matter contrast is better seen in a photon counting CT versus any other CT scanner. Radiation dose is less and image quality which is perceived is also better with a photon counting CT. a very, very powerful and convincing statement from one of the neurointerventionists in Netherlands, saying that with a photon counting CT, they optimize the visibility of small size arteries in the brain, which 40% of all ischemic strokes are because of occlusion in M2 and M3. Yeah. Let's say if you have a conventional CT, we are acquiring with just zero point 0.6 mm of slices. Photon counting CT acquiring at 0.2 mm. So you have higher spatial resolution, lower radiation dose, better diagnostic confidence. And then they said that they expand the number of patients being treated, because a lot of patients now being referred uh, to them because of the only photon counting CT in the area. Likewise, in pulmonology, I'll be covering very quick. Yeah, interstitial lung diseases is considered to be very complex, so there it's very difficult to diagnose on a CT scanner. Mostly when, even when you do a CT scan of a patient with current generation CT scanner, we cannot diagnose these patients on a CT because of insufficient information, clinical information available with these patients. Yeah. So I'll show you a case which is from University Hospital Augsburg, Germany. So this patient is being scanned on a photon counting CT. Yeah, and in the same scan, the spectral information is available. The dual energy information is available. Of even though this patient is scanned for a tumor search, yeah, but since we have this spectral information available automatically with the scanner of lung PVV, lung perfused blood volume, and when we have seen, it has been identified that this patient has CTEPH, chronic thromboembolic pulmonary hypertension, which either you cannot detect or diagnose in current generation CT scanner, or you have to call patients again and again for multiple scans, follow-up scans, or have to follow a lot of protocols, different procedures. But photon counting CT picked up the information which is missed out or can be potentially missed out by other CT scanners. Yeah. Again, this is one of the very important statement we got from University Medical Center France. Their workflow for thoracic imaging was, usually they do scintigraphy prior to do CT scan. Yeah. Now they are saying that this is no longer justified if the CT scanner alone can provide the morphological as well as shows the perfusion information. Yeah. So these are the technology and some of the clinical benefits of the photon counting technology. And in the future, we see this is the technology that drives the radiology fraternity. We see leading institutions who are early adapters of this technology getting equipped with this photon counting technology. And there are a lot of publications now available to substantiate in terms of radiation dose potential reduction, amount of contrast media, and also seeing the unseen, which is not possible to see in the current generation CT scanner. However, you can potentially see in a photon counting CT. Yeah. Um, that's the end of my presentation, but I would be happy to answer any of your queries, and thank you very much for your patience listening.
Thank you very much for wonderful presentation. And we have currently now the revolution of CT scan. Just one question anybody would like to ask for Siemens company how to lower right the CT scan because it's very expensive so far. Just it's the only it will be the only question from the floor from all of the attendant here because of wonderful imaging. And we love, yes, one question from,
Yes, doctor. Yes. Yeah, so doctor, that's a really nice question. So there are a lot of publications which are coming up. I'll share with you offline also after this, where they say that the differentiation has been improved versus what you could see in the CT, and then they try to compare with MR also. But yeah, MR being the gold standard, but from this conventional CT, it has improved a lot. And then you have higher resolution imaging possible with the CT scanner at without dose penalty to the patients. And then it's, since it's a new detector technology, doctor, like in conventional CT, the one image that you see is a combination of around approximately 30,000 of x-rays. Yeah. in a photon counting CT, you have information from each and every photon. So of course, when it comes to the differentiation or image quality, it's better. It's a lot better.
Thank you. Any more question? I saw a lot of neurologists among the attendant. Any question for Photon City? Yes, one more. Yes.
Yes,
Yeah.
yeah. Yeah.
Yes. Good. Good question.
Yeah, yeah.
Yeah.
Yeah, so that's a really nice question. So first thing is in neuroimaging, the first artifacts that we see are beam hardening artifacts. Yeah, that has been completely eliminated in this technology because why we used to have beam hardening artifacts when we do a CT because of the electronics in the detector. Yeah, first thing is that has been taken care. There's no electronics. There's only semiconductor material, and then there are no ADCs, there are no photodiodes. We have pixelated anodes and cathodes. Yeah, so that's been taken care. Second thing is to further reduce the artifacts. We have something called iterative metal artifact reduction technology equipped with this detector. So the amount of artifacts that you see is greatly reduced. Second thing, which is a very important parameter, I would say. So doctor, if you acquire one image at zero point 0.6 mm versus if you acquire an image at zero point 0.2 mm, when you acquire at lower slice thickness, image sharpness is better and artifacts are less. On the top of it, this technology has inherent spectral information available, whether you switched on or switch off or whether you prospectively select. So you have something called mono energetic plus available, where you have KEV slider. Yeah. So if you slide that, that will greatly reduce in your images. Yeah, you have a slider which is shifting from 40 keV to 140 keV. So with combination of all these three of high-end technologies, the amount of artifacts from this clips, coils, or even the conventional beam hardening artifacts are greatly reduced, doctor. But thank you very much for this question, sir.
Thank you so much for wonderful technology from Siemens and from Vietnam. We waiting for the first system. Will be available around next month. I will update all of you for the next during the next meeting.